Hi, it's Andrea, me again with a daily tip. So today's daily tip probably be a bit shorter than the other one, but I thought we'd pick up on a bit of a theme. Before we were talking about makeup and turning up right. Turning up, let's talk about that. Turning up and how you show up. Kind of flows on a little bit to if we're doing social impact work. And in fact, if you're trying to help anybody, in fact, but social impact work, it's also about meeting people where they're at. So when I say that, I mean, for example, think of your hierarchy of needs. If people are at the bottom of the hierarchy of needs and they are living their lives from week to week, day to day, trying to figure out how to feed their kids, put a roof over their heads, you got to take these factors into account when you design your interventions, your programs, your policies, your strategies. Now, let's take, for example, the Australian Indigenous peoples. Now, I don't know how many people know this, but did you know that the term Fourth World was actually termed to describe Australian Indigenous people because third world conditions didn't quite capture how bad their living conditions were? Think about that for a minute. Australia's a wealthy country. Why? Now, we spend billions of dollars on what we call closing the gap between Indigenous and non-Indigenous peoples in Australia. And for the most part, we haven't moved the needle at all. I think there's one metric in health of 0 to 4-year-old survival rates that we've had a little bit of, moving the needle, but overall, not really. And that's despite billions of dollars. Now, here's the catch, and this is what I believe to be true, is that we pitch our projects or we design our interventions at a level that they're not at. So if you go in here and they're down here, then you're setting them up for failure. And that applies to everything. You can apply that to homelessness. You can, it's the same with homeless people. A lot of people aren't going to like this, but if you're giving people things all the time, and homeless is a perfect example, we give them we feed them while they're on the streets. We'll give them blankets. And never does it stop for us to think that, are we actually helping them stay on the street? And I would argue that when you give someone something, you help them to stay where they are, as opposed to helping them, supporting them to move out of where they are. So just food for thought, tip of the trick, when you go in, baseline people. In a social impact assessment, we call it a social baseline, baseline the whole community, but that translates right down to the individual, to small groups, to societal level. A baseline is finding out where exactly somebody is at. So if you're talking individual level, you want to know what's their family situation, what's their income, how often, do they have a roof over their head, you want to know as much as you can about their current position, because there's no point trying to design any kind of intervention unless you absolutely understand their current situation and where they are actually at in terms of their mental health, their physical health, their ability to take care of themselves. So you want to know what their functionality is. You want to know how much support they do have or don't have, how connected they are to their family, to friends, to social networks. So ask the questions before you start designing and really understand where individuals are at, families might be at, if you're working at community level, where the community's at, and start where they are and design it to move them to start where they are, but then understand the incremental steps to move them along the path to a desired outcome. And that desired outcome should be their desired outcome, not yours. Because remember, like I always say, it's not about you. Anyway, that's today's daily tip, and I'll speak to you soon. Bye.